Hi, everyone. My name is Gelareh Sadigh. I'm Associate Professor of Radiology at University of California, Irvine, and also Director of Health Services and Comparative Outcome Research. So this is part of a video series that we are creating as a quick guide for SAG Award application to help our SAG Award applicants to get a little bit more input of what are the score driving factors that they need to consider when they write their SAG Award application. And today I'm going to talk about the approach section. So the purpose of the approach section is to describe how the research will be carried out. And it's one of the score driving sections. Often it's gonna impact your overall impact score depending on how much detail you opt to put in this section and or how well written the section is. As a general rule, for any part of your approach section, not only you're going to talk about how you are carrying on the research, it's also good to talk about why you have chosen a specific intervention or a specific outcome measure over the others, because that's oftentimes where the reviewers comes and think about the why, like this approach has been chosen as opposed to another approach. So when you write your grant, you actually talk about your why as why you chose this approach and why you didn't choose another approach. It kind of flows well when the reviewer reads your application, and then the reviewer understands that you thought about all these limitations. In general, approach section has different subsections or subheadings, and these parts and subheadings can be short or long depending on what the application topic is. The first part that you want to talk about is the study team. You just want to put a short description of your study team, like 2-3 sentences. The factors that is important for the reviewer is a multidisciplinary team with complementary expertise. For example, if you have a statistical analysis in your application, unless it's something very simple, you want to have a biostatistician as one of your co-investigators. If you are planning to interview your participants, you want to have someone who has experience conducting qualitative interviews as part of your co-investigators. If you are having someone that, if you're having an intervention, a specific intervention, you want to have someone on your team who has experience with that intervention. So it's very important that you have the right people on your team with that specific expertise, and you specify the expertise, like our team members are Dr. X, who has expertise in topic number A. Also, sometimes it's good if you have evidence of prior collaboration. Again, you mentioned that in your report. Again, this is optional for these smaller grants, so probably the chances that there are prior collaborations is less. But if you have a prior collaboration with your team members, you want to, again, mention that in this section. The next section, as part of a method or approach, is preliminary studies. Again, this part is optional for these smaller seed grants or pilot grants. If you have some preliminary studies, you want to talk about basically them in 1 or 2 paragraphs. And usually the studies that you're talking about should be either a study that you as a PI has conducted or one of your team members. I would not cite a study that is not done by any of your team members and it's just published outside. I mean, that's not your preliminary studies. And also you want to pick the preliminary studies that are relevant to your proposed application topic or a methodology. Again, if you don't have preliminary studies, that's okay also. So this is more an optional piece. The next part is you want to have a 1 or 2 sentence in a section called Overview of Design to summarize what your method section is about, how it will result in accomplishing your study aims. And you want to talk about what design you have. Is this a cross-sectional study? Is it an observational study? Is the pre-post intervention? Is the randomized control trial? So you want to give like a small blurb of idea of your reviewer is looking at what type of application in that 1 or 2 sentence. And then you're going to expand on that obviously later in different sections. The next section is the study population that you're talking about. So for every study you're proposing, you're probably going to have study population. The study population can be, for example, medical students if you're creating educational materials for them. It can be faculty if you're creating a wellness program with them. So they are going to be your study participants. And you need to specifically outline here what is the eligibility criteria of these study participants. For example, these are faculty from a specific department, in a specific subspecialty, or you're including faculty from all departments. And also you want to, again, specifically mention why that specific population is selected. If there is another population that your intervention can help for, can be helpful for, but you have not selected it, you want to also mention why you have not selected another population. So again, give as much details as possible. You want to talk about your study site, meaning that where this study is being conducted. Are you planning to have the study only at your own department, your own department at institutional level? Are you planning to open up this study to all AUR members and basically recruiting through AUR? So you want to talk about that. And then you want to talk about basically your recruitment method. So what is your outreach method? You are planning to, let's say, have a program for an educational program for your residents. Obviously, you are not expecting every resident to participate in research or even quality improvement project. So how are you gonna outreach to the residents and find out who's interested to participate or not? How can you decrease selection bias that not only a specific group of people respond, yes, I want to participate in your study to you? How you can use gift cards or other ways of incentivizing to reimburse the participants' time to encourage them to participate in your study. So these are all the things that you want to talk about in your recruitment section. Next section is the intervention you're proposing. Again, for the SAG award, usually the types of studies that we see, and you can go and check like what type of studies were funded before, are some sort of a program, a leadership program, an educational program, a wellness program, a program to promote women in radiology. So that program is basically your intervention, and you want to talk about all the components of that intervention that we are talking about. So what does this program entail? You don't need to put, like, for example, the weekly schedule and be repetitive. Like in a paragraph, just sum it up. What does your program include? It involves, for example, you're inviting speakers from institutions or in this field to talk about a specific thing. And the topics that they're going to talk about includes this and this. So not only you want to talk about what are the components, the specific details or topics of that intervention, you want to talk about how this intervention is delivered to your participant. Who is delivering this? Who is the speaker? How often it's supposed to be delivered? Is it every week? Is it every month? Through what modality? Is it a lecture? Is it an online webinar? Is it an in-person meeting? Is it just an educational material being mailed out to people? Is it meetings like in a fun place. So you want to talk about all those. And then you want to also mention that you have experience with that intervention that you're proposing and its success. Specifically, again, I mean, there's a reason you're doing that study. You probably have passion for it. You probably have done some sort of preliminary work. You want to outline those that you are the right person to deliver this intervention and to be the PI of this study. And then also you want to talk about who is going to receive the intervention. Is it everyone that you recruited? Is it a subgroup of population or participants? And what if it's a subgroup, what are the characteristics of the people who are receiving it? And then also you want to talk about intervention fidelity, meaning that everyone who is supposed to get the intervention are getting the same intervention. It's not that your intervention changes from one day to day depending on the situation. So you are having a consistent plan to deliver the same intervention to everyone. Next section is about outcome measures. So here you want to choose an outcome that is expected to be changed with the intervention that you're proposing during your study period. So that's very important. First of all, like your outcome really should change with your intervention. I mean, sometimes we see that people propose, for example, an intervention to decrease burnout, and their outcome, yes, it's a measure that assess stress, but it's a measure that assess stress in, if you look at like the history of it like in a specific scenario, for example, in the post-trauma. So you want to use actually a measure that really is related to the intervention that you are proposing. And also you want to make sure that, again, as we mentioned, it's changing during your study period. SAG award is 1 year. So if you want to have an outcome that is measurable at the end of your study, that outcome should be able to be measured during the study. I mean, sometimes there are some long-term goals. For example, increase leaders who are women, as an example, as part of a leadership for a women initiative. But I mean, increasing leaders who are women, that takes 5 years time period, 10 years time period. So you can't accomplish that in 1 year. So in 1 year, maybe you want to look at more short-term goals. For example, satisfactions. For example, how does the person themselves, I mean, think about the program, or their confidence in doing something has increased. So, I mean, changes in knowledge, changes in satisfaction, changes in confidence, changes in participation in a specific thing, or accomplishing some more short-term outcomes. Also, whatever outcome you choose, you want it to be easy to measure, because you're measuring it for all your participants, and it should be something measurable. You want to have a clear description on how the outcome is measured. Is it through survey? Is it through qualitative interviews? Is it through any modality that you're trying to use to measure it? At what time point is it measured? Are you measuring it at baseline before giving the intervention, and, for example, 6 months after intervention? So or like, I mean, more often, every 2 weeks you are measuring it. And via what method? Which again goes to the fact that, is it survey or interview, or a more objective way? For example, participation in a program, number of clicks on a specific website. And then if it's a survey that you're using, try to use validated measures. Obviously, not every measure gonna be validated, but if you can find validated surveys that are relevant, those are gonna be very helpful. And if you're planning to run qualitative interviews, those are a little more complicated, so you wanna have more details. Who is planning to conduct the interview? Is this a one-on-one interview or a focus group interview? How long this interview gonna take? Where is this interview gonna happen? Is it a phone interview? Is it a video interview? What are the topics that are going to be discussed during that interview process? Are you using a sort of a conceptual framework to conduct your interview? And then you want to talk about participant retention. Yes, you recruited a group of participants, you delivered an intervention, you are expecting not everyone gonna stay in your intervention or complete your follow-up as you expected. I mean, there are going to be loss to follow-up. So what are your plans to have participant retention? And also a good use of gift cards, like again, like if you're giving a survey, so you reimburse persons for their time. If you're running an interview, reimburse for the time, or any other sort of kind of improving that participant retention that we are talking about. Next section you want to talk about is your sample size. Again, it's not a like large research project that needs a very complicated sample size calculation. I mean, usually like SAG awards are more of a feasibility or pilot awards. So, so you want to talk about feasibility, like if you are planning to include again medical students, how many medical students is in your department that you are planning to include, like you give some estimates. And of them, how many people do you think that going to consent to participate? Not everyone going to participate. And how many people are going to drop out at the end of your intervention, and come up with some numbers and see if it makes sense. You want to talk about how you're running descriptive analysis or how you're running more complicated analysis to compare the effect of your intervention on your participant. And then you want to have also a section to talk about the challenges and solutions. So usually as part of any study, there are some challenges that you can think of. For example, your intervention doesn't go as planned. So if it doesn't go as planned in the middle of your study, what are you going to do? What is your solution? How are you going to propose a change in the plan so that you still get the same outcomes you were looking for? If you can't recruit enough people, what are you going to do? So you want to have a couple of sentences also about what are the challenges and solutions that are out there. And that's it. If you need more information, you can check out the AUR, any questions, and we'll get back to you. Thank you very much and have a great day.